Welcome, Professor Raul Cutait. Professor Cutait is Professor of Surgery at the University of Sao Paulo. Also in Sao Paulo, he's the Chief of Colorectal at Sírio-Libanês Hospital and a very dear friend for many decades. Welcome, Raul.
Thanks, Steve.
Raul, we're going to be talking today about something different than what you and I normally converse when we're not talking about our families and our children and what they do, and we're not talking about colorectal surgery, but you've been kind enough to agree to discuss your own 1-month ordeal in hospital as a patient with COVID-19. And I know that's a lot to bear to the world in an interview, but I'm grateful to you for sharing your reflections a little bit about what happened to you with your illness with COVID-19.
Well, I suffered, but I think my family suffered much, much more because I was in tube for 2 weeks. I didn't realize what was going on, but my family was always concerned about me because doctor said, well, he's not doing well, you have to think about it. Something can go to the wrong way and things like that. But the point is that I followed what was told to me. Now, I went to ICU, spent a week in tube. They did everything. I left tube, spent another few days, and I did improve. Went back to tube for another week. And then the last week, just recovering, doing physiotherapy because the muscles shrink. Now you get very weak. And unfortunately, when I left the hospital 2 weeks ago, I was already giving my first steps. Now I'm still doing physiotherapy once a day at home. And now I'm okay. I'm walking half an hour without problems. I'm doing exercise and recovering my capability of before. That was good. There was always a few things that you think about it. When I was intubated the second time, Steve, there was a moment, I don't know exactly when and how long did it take, but I was feeling that maybe I would not survive. And then I had in my mind a few things, not a review, but things that I wanted to do and I haven't done yet. Like I want to stay with my family. I want to still love them. And I know they still want me, they need me. So that was a very strong feeling. I felt that I want to keep seeing my friends, people that I like all over the world. And you are one of my good friends, and I'm very happy because of that. And a few other things like, have some good wine, hear some good music, things like that, part of the everyday life. And you and I, we work too much. Sometimes we don't pay attention enough to this part of life. And but then I decided I want to survive. I don't know how much did it help, but the point is that I survived. I'm here and happy that I'm here. I think I almost met death. What I learned is that we deal with death all the time for decades, you and me and some other colleagues. But now I saw death in my front door. So I realized that death really exists for me. So I know that she's going to be taking care of me, but not now, in the future, not now. I'm not in a hurry for that. And there were a few things interesting because we pay too much attention for the doctors. But there's a team of what I call the invisible angels that take care of you in a sense that makes the whole difference. Now the nurses, the physiotherapists, the nutritionists, all of them together help to keep you alive. And I was happy that I was being treated in in my own hospitals. The hospital I work at Sírio-Libanês is one of the references in Brazil, and with a very low mortality. And so I was happy that everything ended in a good way. You know? But I was always considering, how about the people who don't have this lucky to be treated in a good hospital? In Brazil, there are many people dying before they get any kind of medical assistance. You know, we've been created thousands of new ICU beds, but it hasn't been enough. So there are places in the country that people are dying, and this hurts, you know, because the inequity in Brazil is tremendous. It's tremendous. I was just reading a paper that says in Brazil, it's most like all over the world, the 1% of the population has 28% of our wealthy, 9%, 20% of our wealthy, 40% the intermediate people, 30%, and the poor people, 50% of poor people, they have 14 only of the wealthy. And this is similar to many, many other countries. You know? So these poor people, they don't have the chance to be well treated most of the times, or at least many times. Like happened in New York, you know, the people who were dying in New York mainly were poor people that didn't have any health insurance. The world has to be changed. So the one thing that I really touched me is that all of us, not only the economists, not only the politicians, but all of us have to pressure the world to change. Now, in a world that 1 billion people doesn't have enough food, something's really, really wrong. That wasn't one of my thoughts. Yeah.
Well,
the other thing, Steve, I see people ask me, well, how about now? Do you probably review your whole life? You want to change this and that? I said, no, I'm very happy what I do. I don't have to change anything. The only thing that I have to change is to deal better with my time. I can't waste time, you know. And I see you are the worst example for that. You go to a meeting, spend 24 hours, and go home, and you don't see what's going around, you know. So we do this mistake, many of us, and you are number one. We do this kind of mistake, and there's so many beautiful things around. It's part of life. You're not going to be a worse doctor if you spend another day just looking around. You're not going to be a worse doctor if you don't do anything during the day and go to sale or whatever. So life is a combination of a lot of things. And to become a good doctor, it takes not only 1 year, it's a whole life. So this is something that I think I'm going to pay more attention from now on.
Well, thank you very much, Raul, for sharing your insights. I was praying for you daily, as I knew both you and Angelita, two of my favorite Brazilians in intensive care. And thankfully, you're both home. And I'm very pleased to see you in front of me, back at work, doing well. I know Marcy and the kids are more thrilled, obviously, than anybody. You know, the world needs you. Your family needs you. I'm so happy that you've pulled through this the way that you have. I certainly appreciate your insights and reflections today. I'll try and take to heart what you said about stopping to smell the roses, as we say.
Think about it. Think about it. And I appreciate the opportunity to have this talk with you.
Okay.
Yeah.
All right.
See you
Stay well,
soon.
my friend.